Hello, I'm Cam Patterson, Chancellor of the University of Arkansas for Medical Sciences. Today, the UAMS Fay W. Bozeman College of Public Health released its latest projections of the effects of COVID-19 in Arkansas. These forecasts, like those released in the past, rely on data provided by the Arkansas Department of Health and on conditions remaining the same. In today's report, the 15-day forecast continues, predicting an increase in the number of daily cases, hospitalizations, and deaths due to COVID-19. The models predict cumulative confirmed and probable cases in Arkansas of more than 328,000 cases by March 1st. That's an increase of about 15,000 cases in the next 15 days. The models predict more than 17,000 cumulative hospitalizations, more than 4,600 intensive care patients, more than 5,900 cumulative deaths by March 1st. That's an increase of more than 650 deaths. Projections continue to be that Arkansans between the ages of 35 and 59 will experience the highest number of COVID-19 cases. Young adults 18 to 34 will have the second highest number of cases. Those two age groups will make up about 2/3 of the COVID-19 caseload in the state. The greatest number of hospitalizations continues to be in adults between the ages of 60 and 74. Children younger than 17 have the lowest number of hospitalizations, although we anticipate 53 more children will be hospitalized with COVID-19 in the next 2 weeks. 40 counties had rates greater than 40 per 10,000, with 2 counties, Cleveland and Monroe, having 2-week rates greater than 100 per 10,000 residents. All counties in Arkansas reached a cumulative COVID-19 case rate greater than 500 per 10,000, suggesting that 1 in 20 residents in every Arkansas county has been diagnosed with COVID-19. In 22 counties, 1 in 10 residents has been diagnosed with COVID-19 at some time during the pandemic. Now, I invite Dr. Mark Williams, Dean of our College of Public Health, to explain the latest models in more detail.
Thank you, Chancellor Patterson. There's finally some good news in this report, which is a refreshing change from the reports of the last few months. The good news may not be permanent, as I will explain later, but it is something we can temporarily celebrate. In addition to our usual forecasts, I will be presenting the results of 2 new investigations we've been conducting about the impact of community vulnerability on COVID-19 infections and deaths, and about the impact of COVID-19 on cases and deaths in Arkansas nursing homes. As always, we begin with the 15-day forecast of COVID-19 cases in the state. The 15-day forecast of cases for March 1st is 328,933, or around 15,000 additional cases. In our previous report, we forecast 321,453 cumulative cases by February 15th, compared to the 313,348 cases reported to Arkansas Department of Health. The forecast differentiated by about 2.6%. The decline in recent cases is reflected in a slight downward trend of the slope in the figure. Almost all counties in Arkansas showed declining COVID-19 cases in the last 2 weeks. However, 5 counties showed increases. The greatest increase in cases was in Sevier County, which saw more than a doubling of cases between February 1st and February 14th. This slide shows the per capita COVID cases for each county for the 2 weeks between February 1st and February 14th. 2 counties had per capita rates above 100 per 10,000 residents. In the previous report, we saw a clustering of high per capita case rates in eastern Arkansas. In this report, we still see some clustering in eastern Arkansas, but also relatively higher per capita rates throughout central Arkansas. For this report, there are 48 counties in the state with less than 50 cases per 10,000 residents, compared to the 20 in the previous report. This reflects the decline in cases across the state. The 60-day forecast provides a look at what might happen between February 15th and April 15th. As shown on this slide, the 60-day model is forecasting around 400,000 COVID-19 cases in Arkansas by mid-April. If all things remain the same, the state will add over 84,000 new cases in the next 60 days. Nursing homes present a special setting in which COVID-19 has had a profound impact. Nursing home residents often share rooms and recreational and dining areas, and they are often not allowed to travel outside of the nursing home itself. We were wondering how nursing homes in Arkansas have fared compared to nationally. As can be seen on this slide, there is a significant difference between state and national per capita COVID-19 cases in nursing home residents. The average weekly per capita case rate in Arkansas nursing homes peaked at 44.1 in late December 2020. Since then, the weekly per capita case rate in Arkansas has declined to 15.6 cases per 1,000 residents. In comparison, the average per capita case rate for all U.S. nursing homes peaked at 14.7 cases per 1,000. We also found a similar disparity in the number of nursing homes reporting no COVID-19 cases. Of the 220 nursing homes in Arkansas, only 4, or about 2%, of all nursing homes in the state reported no COVID-19 cases to date, compared to 7% nationally. The 15-day model is forecasting 1,260 individuals will be newly hospitalized for COVID-19 between February 15th to March 1st, an increase of 8% over the previous 2 weeks' hospitalizations. Hospitalizations in Arkansas are forecast to reach 17,190 cumulative hospitalizations by March 1st. We wanted to get some idea of how health disparities might be related to COVID-19 hospitalizations in Arkansas. To do this, we used an index of community vulnerability to assess how social and environmental determinants were associated with hospitalizations for COVID-19 cases, and then looked at them as they were distributed across counties. The index is a measure of county-level population data, including socio-demographic characteristics, race, ethnicity, housing and transportation, underlying health conditions, healthcare system capacity and preparedness, population density, and numbers of high-risk environments such as nursing homes and prisons. We examined vulnerability scores in median hospital rates per 100,000 county residents over time. Differences in hospitalization rates by levels of vulnerability are represented by the 3 bars in each of the time periods on this slide. In all 4 time periods, COVID-19 hospitalization rates were higher in the most vulnerable counties, and the difference appears most pronounced in the months of November and December. In other words, the most vulnerable counties had consistently experienced a disproportionate burden of COVID-19 hospitalizations during all phases of the pandemic. The 15-day model is forecasting almost 6,000 cumulative deaths in Arkansas due to COVID-19 by March 1st. We should expect an increase of 659 deaths, or 12%, in the next 2 weeks. In Arkansas, 2,091 residents of Arkansas nursing homes have died due to COVID-19, which represents 40% of all COVID-19 deaths in the state. Death rates per 1,000 nursing home patients in Arkansas and the U.S. over time are shown on this slide. The average Arkansas nursing home COVID-19 death rate peaked at 8.6 during the week of September 13, 2020. By comparison, the U.S. rate did not peak until December 20, 2020, when it reached a significantly lower rate of 6.7 deaths per 1,000 residents. Of the 220 nursing homes in Arkansas, 15% have reported no resident deaths due to COVID-19. By comparison, of the 14,934 U.S. nursing homes, 24% have reported no resident deaths due to COVID-19. We also wanted to see if community vulnerability had an impact on COVID-19 deaths. Differences in the median death rate per 100,000 county residents is shown on this slide. In the early months, COVID death rates were higher among the most vulnerable counties, indicated by the red bar. However, November-December death rates were higher among the least vulnerable counties, indicated by the green bar. In other words, the most vulnerable populations experienced a disproportionate burden of COVID-19 mortality during the initial phases of the pandemic. During the middle 4 months of July through October, we see that the death rates are similar among all vulnerability groups. Most recently, least vulnerable communities have had a higher death rate. This is likely due to the generalization of the pandemic in the state, rather than an improvement in local county conditions. While we have seen fluctuations in the forecast and projections in the past 2 weeks, the takeaway message from each of the College of Public Health COVID-19 forecasts remains the same. The pandemic is not over. We must remain vigilant and practice good public health mitigation behaviors. The recent inclement weather has acted as a de facto stay-at-home order. We expect this will have a beneficial impact on the state's COVID-19 cases, hospitalizations, and deaths. Arkansas residents have been at home with restricted interaction with people outside their immediate households. So while none of us probably like travel restrictions or the boredom of being at home, there is a silver lining. Coupled with increasing vaccinations, we should see fewer COVID-19 cases in Arkansas in the next few weeks. The example we used to explain recent trends in the pandemic in Arkansas was a hurricane. As with a hurricane, we should not expect the numbers of COVID-19 cases, hospitalizations, and deaths will be consistent through time. There will be times with higher numbers, as during the holiday season, and times with relatively lower numbers, such as what we are experiencing now. But as we continue to emphasize, the pandemic is not over. We are certain the UK variant of COVID-19 is circulating in the state. This variant is 50% to 70% more infectious than the original virus and will hospitalize and kill more people. We are also certain some of the other 7 known variants in the United States are also circulating in Arkansas. We do not know the extent to which those who have already been infected with COVID-19 will also become infected with a new variant. The full impact of the variants will not become apparent for 3 to 4 months. Using a forest fire as a model like we have before, about 10% of Arkansas's forest has burned. That is, people have been infected. Another 10% has received adequate rain and is unlikely to burn, or they've been fully vaccinated. But 80% of Arkansas's forest is still at risk. The fire is burning at a slower rate, but we only need a change in the wind for it to begin to burn again aggressively. Until we've vaccinated large numbers of Arkansans, we need to remain vigilant, wearing masks, social distancing, and staying at home as much as possible. Stay healthy and stay safe.